Thank you indeed. Stay around, Martin. We'll need you during the discussion. Okay, the next speaker is Forbes McGain. Dr. Forbes McGain is an anaesthetist and intensive care physician at Western Health in Melbourne. He's also an associate professor both at the University of Melbourne and the University of Sydney. And I'm guessing, Forbes, that they haggle over you vociferously. He's also a member of the Doctors for the Environment Australia. Welcome, Forbes.
Thanks very much for the kind introduction, Jeffrey, and thanks everyone for a most interesting session and prior session earlier today. Thank you, and I'll roll straight in. Disclosures, no funding from any relevant sources, member of Doctors for the Environment, and I certainly acknowledge all the marvellous collaborative efforts of doctors, nurses, allied health engineers, planners, bureaucrats, etc., doing a long time of advocacy and research. Hello to all the hospital sustainability officers out there. You're all doing a great job, and work with Wiser Healthcare and other groups, Scott McAllister, etc. It's been lots of fun. It's been a real journey. I will say just briefly, I remember being worried, and I still remain worried about destruction of nature, species mass extinctions, overconsumption, overpopulation, but I didn't do much about that. And apart from work with the Australian Conservation Foundation, I just worried, which wasn't really helping me or anyone else. And it was only when I was actually in Alice Springs working in anaesthetics intensive care and a flying doctor that I really began to think a bit more carefully about what my role could be, rather than hugging trees, but actually trying to do something within healthcare itself to make it a bit more sustainable. And thinking back, for those who visited Alice Springs, the Todd Mall, the old replica of the original Alice Springs Hospital, beautiful big verandas, really thick old stone building, and how that has changed with time, and how perhaps less sustainable building models are there with heating, ventilation, air conditioning. Also, what maybe started to think there in a desert environment was how we're actually using bucket loads of water for dialysing patients. In particularly, I remember watching this ton of water disappearing down the drain in a desert environment and thinking there's something slightly wrong here. But that goes on. Work I mentioned Simon Putti and others doing with Purple House, trying to get things changed there. So that made me really think that the environmental effects of me at work, sadly, with all due respect to my team at home, work matters much more than home because there's just so much energy and so much waste being produced at work. We've already mentioned the broader picture, which I think is useful just for everyone to be aware of, that the whole concept of the carbon footprint of healthcare itself. I know this is being increasingly modelled and looked at, which is good work by teams around the world. And we know that the carbon footprint of Australia's healthcare is about a half of what agriculture is. It's an interesting number to think about. On a more local level, for those who are not anaesthetists, our DES frame, which has a high global warming potential, in other words, a greenhouse gas, using just 1 hour of that to keep you asleep is like keeping you asleep for 2 days with sevoflurane, which is a much less problematic gas. It's not that you need to be asleep for that 2 days, but it's just saying that you can use a lot less from a global warming perspective, sevoflurane. And that 1 hour of the DES frame is like burning 30 litres of petrol. So it's actually, you suddenly get ideas of some fairly big carbon hotspots that are present. And I want to show you some of the other research we've been doing. I know Alex Barrett has already mentioned life cycle assessment, looking at the carbon footprints of things. And I just wanted to just touch on one little example which led off to all sort of interesting avenues in our research as we went along. We were looking at reusable versus disposable laryngoscopes and face masks and circuits, all those sorts of things you use as a standard approach to keeping people asleep. And we compared the Austin, which was all disposable stuff, compared to Western Health, where it was all reusable. The idea was to chuck away all the reusable ones and go for disposable because it was supposedly cheaper financially. Well, we found that that was actually incorrect, and that was including the costs of using all of the time and motion studies behind that. behind the scenes of the Central Sterile Supply Department team, and you save about $5,000 per theatre per annum, so saving Western Health over $100,000 a year by using reusable. But what we're also interested in was the comparison between the disposable and reusable from a carbon footprint point of view. So here we are, you can see we're just tracking what is happening to all of these reusable things. For disposable, you didn't have to do that part of the story because you just chuck it all away. It's only the cost of making it in the first place that matters. And then you had to measure what was going on in the sterilizer. You can see packaged back here, nicely gift wrapped to keep it nice and warm is the sterilizer. And we measured the Wi-Fi output of that sterilizer for almost a year. Lots and lots of runs, lots of interesting work. What we found in a nutshell was really surprising in a way, is that here's the red, here's Footscray, it's all the reusable variants of those equipment you just saw the photo of. And down the road at the Austin, it actually had a slightly lower footprint. That's because in Victoria, you're using lovely dirty brown coal for your electricity for the steam sterilizer in particular. Whereas if you're in Europe, just think about green. Just remember from this slide, the green and the red, it's much, much lower, an order of magnitude almost lower, because you've got a very different electricity mix for your steam sterilizer and washers. So it's trying to say that locality and geography really matters and your source of energy really matters. What I also want to show is sort of exciting stuff that's happening in Victoria. Hospitals are going to be 100% electric by 2025, electric with renewable electricity. That's looking really good. What it means is not just the lights and the heating, ventilation, air conditioning that's going to change there. It's also that renewables will be made better by will make reusables better. So it's that concept that if you have renewable electricity, you'll make the reusable equipment better, and you end up going from the red to the green very quickly. And so it's very exciting to think about all of these flow-on effects that occur there. The other interesting thing from our study was the steam sterilizers. By changing subtly how we use the sterilizers, we actually switched off 10 houses worth of electricity every single day. Now, I'm never going to own 10 houses. And so I'm just showing you, here's an example of things you can do that lead to very large changes very quickly. The other point I want to bring out is, although here is all the different states you can see on the x-axis and a percentage of total hospital electricity being used. So it's basically saying Victoria consumes about 1/3 of all of the public hospital energy in Australia. The reason why Victoria consumes more than New South Wales, even though there's 1 million more people in New South Wales, is mainly because we have to heat in winter in particular, but also even though in summer overnight, we are routinely heating hospitals. So blue is the gas, red is the electricity. You can see having 100% renewable is great, and that's really good for somewhere like Queensland, where you don't really use much gas for your hospitals. But in Victoria, really need to change the system as well and get off gas. This was work that Hayden Birch, Matt Anstey and I did, which was just come out in the Medical Journal of Australia. So showing you that the story gets more complex. It's not just about electricity, it's also about gas. So what are the ways to environmental sustainability? I think that we need to get off gas. We need to follow the lead of the ACT, as well as the South Australia. There's some really good work being done there with the new Women's and Children's Hospital with Rob Bunting and the team there. I think there are lots of jobs ahead. Renewable electricity, as I mentioned, and championing for that, particularly in the big states of New South Wales and Queensland. Renewables, don't forget, make reusables better. Get off gas. And think of these carbon hotspots. I know the National Service are already doing some great work here. I think we're really quickly discovering that having a baby, if you're using laughing gas, can be very quickly driving from Melbourne to Brisbane. But these hotspots need to be worked on very quickly. And measuring everything is really important. I think going beyond that is, we've already mentioned choosing wisely and wiser healthcare, that more is not always better when it comes to healthcare. We've heard that from an economic and ecological perspective, and that more clinical sustainability work at the level of research is required. I know it's starting with the National Health and Medical Research Council, but state government innovation grants will be important. I think we definitely need education, the university level stepping up to say this should be now part of standard care. I know Lynn Madden in New South Wales and others are really championing that. Resilience, I think, is important to think about here as well. Local equipment, local central sterile supply department, reuse of equipment in-house. You don't have to worry about long supply chains. Public health initiatives, I should mention, are always about sustainability initiative. Lucy Rychetnik has mentioned that. General practitioners are incredibly important as our community health to preventing people getting into hospital in the first place and looking after them. And I think another important about that I, as an intensive care physician, have just thought we've just used 40 million single-use gowns in Victorian public hospitals last year, and we'll use about the same this year. Step this way, infection prevention, we really need you. We need you to change how we're doing things, because it's not really sustainable. So in terms of the macro, I know we've talked about colleges and societies, the AMA, ANMF, CAHA, or Climate and Health Alliance, and Doctors Environment. I think we need what the NHS has got in the UK, a sustainable development unit at federal and state levels. Universities, I mentioned, we need them to help us with education. I think we're making way with the Australian Commission on Healthcare Safety and Quality with a climate risk footprint, as well as standards. Standards are begging to be done. We need the word environmental to come into our Australian standards. And of course, we need, there is the Environmental Health Standing Committee. I think if anyone has links for that group, please, we need to get them involved with this. And of course, from buildings point of view, the Australasian Health Infrastructure Alliance is important. And I'll leave you just thinking that this is a race, and we need to get on and run it. Thanks for your time.
Thank you very much, Forbes. Very interesting perspectives, and most useful to add to our growing knowledge here.